Julie is going to do a few spots on me first that are a little dry and they look, a little suggestive that I probably should see my dermatologist. Today we are going to do a fractional CO2 to my skin. When we talk about laser technology, the fractional CO2 is the most aggressive laser that we carry. It has the longest downtime, generally somewhere around 4 to 5 days, but it produces really nice results if you can take that time to heal. What the laser does is it makes these little tiny little holes about the size of hairs all through the skin. And what that does is it causes new collagen production because each one of those tiny wounds heal. And as they heal, you produce that collagen, which increases the elastin and the collagen of the skin. And as we age, that becomes thinner and less responsive. And so that's why our skin looks crepey and it doesn't look thick and it doesn't look healthy. So you'll improve the texture, you'll improve the skin tone, you'll get rid of a lot of the discoloration. Not all. This isn't marked to remove all the discoloration. It's really marked to improve the skin integrity. But during that process, some of the pigment discolorations will improve and go away. It's not particularly uncomfortable. I would say probably a pain scale of 5 on a 1 to 10. So kind of middle of the road. It's pretty quick. Process of healing is some tightness and some almost like track marks for a couple of days, and then some sloughing, almost like a peel, and then nice healthy skin, which improves in integrity, lines, and texture over several months. So you see the results once you've sloughed that skin, and it continues to get better. Most patients will do this procedure maybe every year to 2 years to give a really deep, good refresh and to keep their skin looking good. So normally we have an assistant here who does the vacuum. That's what this little thing is, just to get those little air particles away. Julie is going to do a few spots on me first that are a little dry and they look, a little suggestive that I probably should see my dermatologist. So you can see I'm not wincing. This is not a big deal. Now we're going to go ahead and do the whole face. Okay, so we just finished. You can see I'm just kind of red and splotchy. Not terrible, just a little bit blotchy and red and whatnot. And then tomorrow it will start it'll look like little tracks, and the red will get a little bit better. And you can see all the little tiny holes right there. And that's what they look like. Okay, so I'm about 24 hours out, and you can see I'm very red. There's my line of demarcation, and pretty swollen right through here. I'm not in any pain. It's beginning to be a little dry and prickly, almost like a bad sunburn. Tomorrow you'll see a big difference. So today is about 2.5 days out. I got in the shower this morning and sloughed a lot of that dead skin off. So it's a little tender. It's like when you get a sunburn. Still swollen under the eyes, but it's 2.5 days, so not bad. So today we are beginning day 4. We've had 3 full days of healing, and you can see I'm still blotchy, still prickly like a sunburn. Not horrific. Definitely look more normal. This I can hide easily with the mask. Another 24 to 48 hours, I'll be pretty much completely healed on the outside, and then the collagen and the healing underneath the skin will continue for several weeks, but I'll look normal in another day or 2. So not bad for just 3 full days. So we are 5 full days of healing, and you can see I'm still just a little bit pink, nothing terrible, look fairly normal. I could certainly put makeup on now if I needed to. Skin's still dry, a little tight feeling, but basically the healing is 99% done, so relatively easy.